My name is Suhail Mehboobi. I'm the program director here at Lahey. The thing which inspired me the most to join were the people I met. Not only the anesthesiologists, but also surgeons, nurses, technicians. Everyone was like a family. And this is still true. And this is what we instilled in our trainees.
I want to tell you a little bit about what makes our department special. The first thing that I think about is the caliber of our people, from faculty to residents, fellows, nurse anesthetists, to support staff, who all are dedicated to taking great care of patients and each other. Our faculty is innovative, forward-thinking, and committed to using all the latest innovations in anesthesia care to deliver a superb patient and surgeon experience. We pride ourselves on offering daily didactics that provide the residents with short sessions on topics critical to their training.
I think Lahey's anesthesiology residency program is fantastic. We do world-class surgery here, the same types of surgeries that you'll see at larger regional academic centers, but with a small-town academic feel. Here, attendings are one-to-one with residents, which allows for close observation as well as clinical evaluation and performance across all 3 years.
One of the things that drew me to Lahey was the diverse culture of the department as well as of the academic center. I think Lahey provides not only diversity, but also a work environment that is both low stress and cordial in nature. I think that this is one thing that sets it apart from many other places that claim to do the same. Here at Lahey, we truly have each other's back, both personally and professionally, and I think it just adds to and improves on the ability for successful educational experience.
One of the things that drew me to Lahey was the size of the program. I thought it was one of the strengths is being a smaller program. You get to know everyone a little bit better and you're kind of not lost in the crowd, and I think that really shows with our attendings as well. They really get to know us on a personal level, and I think that has made a huge difference overall. I think it's really helped me grow as a person and as a resident in lots of different ways. Helped me with my medical decision making and reacting quickly in tough situations, just with the level of acuity that we face here. But I've always felt supported by my attendings and my co-residents and all the staff here to really grow to the best I can.
Lahey's done a great job in preparing me for my career. I am graduating in a few months and I feel very ready. We are given exposure to a variety of different clinical cases, and I feel very prepared to take care of anyone, no matter how sick or ill they may be. In addition, the program ensures that we have all the numbers we need to be able to graduate safely and feel comfortable going out into the workforce.
Our residency has an ever-growing simulation curriculum that is set in the newly built Altschuler Simulation Center. The center has an operating room space, a multi-use lecture space, and various mannequins for teaching situational and procedural skills. Simulation training is a critical component of our residents' didactics, as it exposes them to rare and difficult situations. This exposure prepares them to perform optimally when faced with these kinds of scenarios in actual clinical practice. Our simulation curriculum includes monthly scenario-based sessions, applied exam OSCE training, and a rotation focused on advanced airway techniques. On top of this, we also have sessions on point-of-care ultrasound and vascular access. In their CA3 year, residents are invited to plan their own teaching sessions in the Simulation Center with mentorship from faculty.
One of the things that I really enjoyed doing was the simulation that we had, just CA1s, just 8 of us. There were 4 different scenarios. They had 2 of us take turns, and then everyone else was kind of watching and helping us through the process. We essentially, piggyback ideas off of each other, trying to see what's going on and how we can troubleshoot it. It's exciting, it's a little nerve-wracking, but what I really like about it is it's a very supportive environment, and we're allowed to, think through our ideas, have support from not only our fellow residents, but also the attendings who are there helping us through the simulation.
Lahey is an incredible group of talented surgeons and anesthesiologists who work together exceedingly well as a team in the operating room. Those close working relationships create an excellent learning environment for residents and students. The anesthesia attendings feel free to openly discuss clinical knowledge and skills in the operating room and in the pre- and post-operative environments.
One of my favorite parts about Lahey, I think, would be the investment that everyone has in your education. Even starting as an intern, you're rotating through, all these different specialties, and you're doing medicine, you're doing surgery, and even if you're not, in that program and they're not anesthesia attendings, everyone here is very invested in making sure it's a good environment for you to learn.
The Lahey Anesthesia Residency Program is one that prides itself on clinical excellence. Lahey Hospital is a level 1 trauma center, comprehensive stroke center, and the largest liver transplant program in the Northeast. We're also leaders in minimally invasive procedures such as robotic surgery, transcatheter valve repair, and replacements. I really believe that graduating from Lahey Hospital Anesthesia Residency Program will lead you to be a confident anesthesiologist in any practice setting.
There are a lot of things that I have loved about this residency program here at Lahey. Really, my number one is the day-to-day clinical care as an anesthesiologist. I love the specialty. It's a true pleasure to meet the people that live in this area, calm them down, kind of explain what's going to happen to them, and then guide them through the whole process of anesthesia and surgery and seeing them wake up comfortable. By far my favorite part. On top of the clinical care, it's a pleasure working here every day. I get to know the operating room nurses. It's a pleasure to see them walk in the morning and see who I'm working with beyond just the attending that I'm with day to day. I like working with the surgeons. We have a team mentality, and at the end of the day, it feels like we've really accomplished something together, and that makes a big difference.
We take resident education very seriously here at Lahey. We train our attendings in teaching and evaluation techniques so that they can best teach residents and students in the operating room.
Regional anesthesia rotation is top-notch. Residents have a structured curriculum. They have bedside education, which is uniquely tailored to each patient. They have dedicated didactics, which complement and enhance the skills of our trainees.
One aspect of the program that I found to be very valuable is the mentorship that we get from our attendings. For me, mentorship was something that I was really looking for in a residency program. So my mentor and I get together once every few months for dinner and talk about, how residency is going and what my future plans are and just life in general outside the hospital. So I've really enjoyed that, and I've enjoyed having someone who's able to give me advice from a bit further down the career path than I am.
I moved to the Boston area from DC and didn't have much of a sense of community here. But even in the short few months that I have spent at the hospital, that changed very quickly. And I have made incredible connections, not only with my co-residents, but also with attendings, nurses, and individuals across all different departments.
Thanks so much for watching. It's been a great experience here. I hope you highly consider us as a program, and we're looking forward to seeing you.
Thank you everyone for watching. Hopefully we'll see some of you guys here next year and we can talk more about how much fun Lahey can be.
At Lahey, we want you to become the best clinical anesthesiologist you can possibly become. After all, you might put me to sleep one day. Hope to see you here.
Lahey's a wonderful place.
If you choose Lahey Anesthesiology for your training, I'm sure you will find this place an excellent place to learn and to be prepared for your future clinical challenges. I hope to see you here.